Hey, David, this is Dr. Smith. I wanted to send this to you in advance of your consultation visit just to kind of show you some of the concerns that I have and some possible solutions. Um, One of the things that we first notice is when you smile and you're not really showing your upper teeth is because you've lost some vertical height as a result of the wear that we're seeing that we'll look at in a few moments in these photographs. But the thing that I want you to see is notice that on the bottom we have very little enamel loss, whereas we have major loss on the upper, on the front, in the front as well as in the back, as well as in the back on the lower. And the reason that I think some of this is going on, when you think about it, typically when we see wear from clenching and grinding at nighttime, it's kind of equally distributed between the upper and lower teeth. Whenever we see a situation like this, where primarily it's more advanced on the top than the bottom, we always have to suspect a chemical component, such as gastroesophageal reflux syndrome. And I'm just wondering if there's not an acid component to this, because it's not real typical to see loss of enamel on the outside, like we see in this photograph here, with such minimal loss here. So I know that clenching and grinding is a component, but I think there may be a chemical component to this as well. And I'm not sure if we addressed that when you came in the other day or not. Um, but we'll look at the photographs and kind of get a better idea. See how we see this erosion here on the outside of these lower bicuspids. Same thing over here, even to the point that this one, the nerve is exposed. That was when you said, don't touch that tooth. I could see that there's a little bit of nerve exposure there, so that's why that tooth has been so sensitive. And so we'll talk about that in a moment. In the upper arch, once again, no wear at all on these molars back here. But as we come forward, which is pretty typical in a GERD situation or reflux situation, where we see advanced loss of the upper front teeth with very little loss of the lower front teeth. So we could look at the idea of placing 2 implants in these sites right here. We have the option of keeping these 4 front teeth versus removal and placement of implants in these 2 sites with a fixed bridge. And I'm kind of leaning toward hanging on to these teeth, because I do think that they've got a decent prognosis, particularly if we incorporate some crown lengthening into this equation. And we'll look at what that entails in just a minute. In the lower arch, very little wear in the back, and it looks more like an erosive component than it does true bruxism wear. And moving forward, not all that much going on down here, and it's more advanced here, which once again I think is related to hydrochloric acid, which is released from the stomach in patients with reflux. So I think you may have some of that going on. This tooth right here, we have the option of performing a root canal and keeping the tooth versus removing it and placing an implant. And I'm really leaning toward hanging on to the tooth, because I think it will have a decent prognosis. These are the digital scans that Tammy took of the models that Dr. Gainey sent over. It's just to give us an idea of what the occlusion looks like. The first thing to notice is the bite is overclosed, and that's a result of a vertical tooth loss in both arches over time. And then moving forward, when we talk about crown lengthening, this illustration kind of illustrates exactly what that entails. And it really means removing some of the gum tissue and a little bit of the bone in order to provide us with a better foundation to retain a crown in a predictable fashion over time. This illustration just shows how on the upper right side, 2 implants. We usually let those integrate for a period of about 2 to 3 months and then come back and secure an abutment in each one of those 2 implants. In your case, it wouldn't be a 3-unit bridge, but 2 individual crowns restoring that upper right side. This is an example of a case not too dissimilar from yours, where we've got complete overclosure, 100% overbite over here. Down here you can see we have a lot of wear on the lower front teeth as well as the upper front teeth. And in his situation, this is more of a clenching, grinding, bruxism situation than acid erosion. And moving forward, this is after the case has been restored. So with full coverage restorations on these teeth, upper and lower, we're able to open the bite back up, keep the teeth, and then restore this patient's smile. This was done 4 or 5 years ago. It's doing real well. But you can see we went from here over to this right here. In his situation, we did take out these 4 front teeth. I think you've got a better prognosis, so we're going to look at hanging on to those rather than doing implants. This is my niece's husband's cousin who came in and wanted his teeth removed and wanted to have implants done, etc. But he's really got really adequate tooth structure, and the situation is not as bad as it looks to him. This is after the case was restored. This is going on 3 or 4 years now. So, implants are wonderful. We use them every day, but there has to be a clear indication for them, and I don't think that that's going to be necessary to get you fixed up. This is going to illustrate how we do the crown lengthening, where this patient's got a lot of preponderance of bone growth over time from clenching and grinding. Yours is pretty similar. Small. The teeth look small, but they're really buried somewhat by this excessive gum tissue, and it gives the appearance of a real gummy smile. When we do the crown lengthening, it's really a matter of removing some of that excessive bone in order to give us adequate tooth structure to retain crowns, and this is what the case looks like after. In his case, we were having to just deal with the upper and lower front teeth, and the back teeth weren't really that involved. So going back to you, we look at full coverage all the way around. I can probably just minimally onlay these two upper posterior molars because they really are in perfect shape. On the bottom, a lot more involved, so we would fully cover all of these teeth. We can simply do some bonding on these lower front teeth if we want to, save some cost and minimize treatment in the lower arch. But really, going back here, really from the eye tooth on back on the right side, eye tooth on back on the left side, it's going to be necessary to cover those teeth to get the bite back opened up. Once again, we can do some minimal bonding on these lower front teeth and keep them as is, or do full coverage restorations at a discounted fee so that we get everything to match up and get the bite idealized. So that might be a consideration. This is what it looks like after we've opened the bite. This is using the Blue Sky Bio software to plan a case like this. And so with full coverage restorations and partial restorations on these upper molars, we can wind up with a situation such as, we were showing in some of those previous cases that I just showed you. So anyway, that's everything in a nutshell. If you have any questions or concerns, you can just let us know. Write those down. This is just a simulation just to show you of what we'd be trying to achieve, and that is by bringing the length of these centrals down, laterals down, and so forth, and open the bite up. With the option of full coverage on these front four teeth, we can make these teeth as white as you want or as natural looking as you want. So there are a lot of things we can do nowadays that weren't available back in 4 decades ago when I got out of dental school. So phase 1 would be sedation with the CRNA. We do the crown lengthening, build up those teeth as well as full coverage. Prototypes are temporaries in both arches. Implant placements as if necessary, but in your case I'm leaning toward not having to do that. Follow-up visits as needed along with a soft guard during the provisional phase. Phase 2 would be sedation again, scans or impressions for the final restorations. We still have this implant option, but I'm not so sure that we'll need it. Phase 3 would be lower arch insertions, upper front teeth, impressions for the lower back teeth, and then finally complete the case and get you in a guard to wear at nighttime. So that's everything in a nutshell. Write down any questions or concerns that you might have, and we could visit those, either having you come back in for a consult, which I think you're scheduled for. If not, we could do this virtually. Thank you.